Hey, David here again. So, on this topic today is going to be all about heat stress. So, let's just dive right into some things that we need to know about heat stress. All right. All right. Let's talk a little bit about the normal cooling mechanism of the body. So, how this kind of works is when your core temperature starts to rise, your blood gets pushed out to the skin in hopes to be able to cool that blood since it's from the core to the outer, the inner to the outer. Now, one way to think of this is, have you ever seen elephants in the wild? Why they have such giant ears, and they're actually pretty thin, because that's where the majority of their blood vessels are in their veins. So when they flap their ears in the wind, it helps to cool their body temperature. They don't have, sweat glands like we do. So that's kind of how they do it. That's what your skin does. Your body temperature increases, core temperature, sweating increases, your heart rate increases. You got to have an increased heart rate to get the blood from the inner to the outer, right? It's like a pump. So that's part of what happens there. When all of these work together, we have a drop in core temperature, which is what we're trying to do. So what is the body core? The core of the body? It's going to be your deep organs, your heart, your lungs, kidneys, liver, those. Your arms and your legs and the tissue closest to the skin are referred to as periphery parts of the body. So we have the inner and the outer. So we got to keep in mind that the periphery and the core are going to compete with each other in the body. So when our cooling mechanisms fail, it's because so much sweat is lost that dehydration results. The body cannot cool us off by sweating, or the core temperature rises too fast and won't come down. Salt, salt loss causes heat cramps. So when you get done sweating and you sweated out everything you got, why you have muscle cramps affected with heat illness or heat stroke is because of the loss of the salt to the body. So much of the blood flow goes through the skin to the organs so that they cannot function properly. The buildup in the body of heat is heat stress. It's generated by the muscles doing work, coming from warm to hot environments. Heat exhaustion and heat stroke occur when the body is subject to more heat than it can cope with, that it can process. So it's kind of like a cooking pot that doesn't have enough room and it just blows and overboils. That's what heat stress is to the body. Heat related illnesses, well, you can get simple muscle cramps, painful muscle cramps, usually in your legs or abdomen, which are the larger muscles. That's why they are affected. These are going to be your warning signs to tell you something's wrong. You want to stop your activity, rest in a cool place. You want to drink plenty of water. You want to get medical attention if no improvements in the first hour. Now, look, I always recommend that if you think you're having any health issue whatsoever in any way, shape, or form, that you go ahead and put that call in and get medical started your way. Because if you wait, you may not be able to make that call. Exhaustion is the body's response to the excessive loss of water and salt. Some symptoms of heat exhaustion is the heavy sweating, the being pale and tired, nausea and vomiting, headaches, blurred vision, dizziness, and fainting. These are all basic signs that you need to be calling for emergency medical care. Heat stroke is when the body becomes unable to control the temperature. Your body is no longer functioning the way it should to reduce your core body temperature. Temperature by mouth can rise can rise above 105 degrees in Fahrenheit in 10 or 15 minutes. Now that's bordering on brain damage. You don't want to fry your brain. That's why this is so serious, folks. Death or permanent damage can occur if treatment is not given properly. Heat strokes kill 4,000 Americans. That's just in America, folks, alone a year. That's a lot. So here's some symptoms of heat stroke. Your oral temperature rises above 103. You quit sweating. Your skin is red, dry, and hot. You're having throbbing headaches, nausea, and dizziness. You may become unconscious. Any of these symptoms should call 911. Try to get help immediately. And if you recognize anybody that's having any of these issues, you definitely need to step in and help them out, all right? So let's talk about first aid a little bit. First thing we want to do is call for help. You want to try to cool the victim down, rest them in a cool place, get them to drink some cool water, remove unnecessary clothing or loosen the clothing, shower or sponge with cool water. Now, here's something really important to understand about the cooling down process. The one thing you don't want to do is somebody who's suffering heat illnesses or symptoms is douse them down with cold water. That's going to could send their body into shock and also cause them just to have a heart attack due to the abrupt shock and temperature to them. So the best thing to do is to use lukewarm water, outdoor water, room temperature water, and use that to cool them down. You got to remember, it takes at least 30 minutes for the body to cool down once it becomes overheated. So you got to give it time, and you got to let the person cool down and do everything you can to help. So on heat stroke, which is the more serious, once again, you got to call medical personnel. Immediately aggressive, you have to start effecting cooling. If you need to immerse the victim in water, you need to do that. Remember, not ice cold water. Room temperature water works best. You can spray them down with a water hose, wrap and take fabric, shirts, towels, get those wet and lay those over them. That works really well. You can fan them and get them cooled. However, you got to get that air circulating around their skin, because remember, that's where the blood is. The blood is pushed out from the core of the body out to the skin. So we got to get that skin down, and you got to get the medical. So here's some risk factors for heat stroke and heat illnesses. If you're overweight, that's a problem. But here's something a lot of people don't know or don't realize, that if you have a very, very small body type or a petite one, you can be at risk also. You may wonder why. Well, the why is because, one, your organs, your internal organs, are so very close to the outer part of your body. Also, the fact that you don't have as much skin, so that when the blood is being pumped to the skin, your surface area is diminished. So that's something. If you have poor nutrition, sometimes smaller people and larger people are malnourished. If you've had a history of heat strokes or illnesses in any way, shape, or form, that puts you in the high risk category. If you don't acclimatize to cold or to heat very well, you're at risk again. If you're over 40, If you have heart disease and high blood pressures, diabetes, other health issues, respiratory issues, then you can easily be at risk. And you got to take these precautions on the front end. So individually, we got to look at, skin diseases, liver and kidney and lung function problems. Folks, women that are pregnant are definitely at risk for these illnesses. General fatigue and lack of sleep, diarrhea and vomiting, dehydration, infections, fevers, sunburns, skin rashes, recent illnesses or injuries. There's so many little things that can put you at risk for a number of situations. Now, if we know what we've been through, or are the folks that we're with, our family, our friends, our coworkers all know kind of what's been going on, then they can better help us. So if you've been inoculated to something, maybe you just got your flu shot, or maybe a dose of shots because you're going overseas to a foreign country. If you've been drinking alcohol in the 24 hours, one thing to keep in mind about alcohol is it dehydrates you. It definitely does not add any hydration to you. If you haven't been eating, if you're malnutrition or your body doesn't process food properly, if you've been on medication and sleeping pills, caffeine, the use of illegal drugs, folks, it can be a devastating one. A low salt diet, which basically just means that you don't have enough salt in your body to help you process everything. Weather, weather is vital. Anytime the temperature rises above 70 degrees during the day or 80 at night, that can lead to your pre-existing conditions or what's going on with you can lead to heat stroke or heat illness. And I always find this one fascinating. Being in direct sunlight can actually add up to 13 degrees in air temperature. So just being out in the sun can be 13 degrees hotter. The humidity level, and of course, little or no air movement. If you have a breeze going on, you have a better chance of being able to cool your body versus it's a very still environment. If you're on the job, working any kind of jobs, indoors or outdoors, you got to be worried about heavy work. So if you're doing hard physical manual labor, that's a risk factor. If you're working long shifts, risk factor. Your heavy and bulky clothing, your PPE, it can become a risk factor for you. And of course, depending on what you're doing for your job, and of course, exposure to any toxic chemicals can lead to these great risk factor there. So let's talk about a little bit about how to control your heat stress. Well, to protect your health can be prevented by treating symptoms while they are early or they're mild before they get set in. You want to improve your safety. Workers with heat stress symptoms are more accident prone. So what this kind of means is we have to use a little bit of common sense. So let's say that I have a couple of guys that I know have had a heat illness history, or they got some heart issues or lung issues. They're overweight. Maybe they drink a lot. I'm not going to put them outside in 100 degrees temperature, making them work. The chances are that they're going to have some situations and problems. So that's something where we just got to know ourselves and know what we're capable of doing and know what everybody around us are capable of doing. And then, of course, keep in mind that people are not very efficient or effective workers when they're experiencing health-related issues in any way, shape, or form. So what we want you guys to do is to train everybody around you on what is heat stress, what is heat stroke, knowing the symptoms, how to treat it, how to prevent it. And the key in this really is all about prevention. As you guys know, the best way to solve a problem is prevent it from happening. So if I know that if I got a crew, guys, or some folks that are going to be doing some hard and hot work, I'm going to do everything I can to rotate them, to make sure they drink plenty of fluids, they stay cool. Some of the big issues are we want to make sure and take into account, the weather, the workload, protective gear, your PPE, and your conditions of your workers. And that's what I mean. You got to size everything up together and figure out how best to do the task and how to keep your workers or your family members safe. So body generates more heat during heavy workloads, right? So, and if you're working in an environment that's nice and hot, you're going to become more taxed. So the more clothing worn, the longer it takes to evaporate and to cool the skin. That's why we like for you to peel down some clothing if you're suffering. Now, the really cool thing in the last few years, there's been some really great advancements in clothing that wicks the sweat away and allows you to cool down. And I own a bunch of that, and I just love it. So there's a lot of really good clothing out there for working in a hot environment. So selecting your PPE, if you're going to be working in these type of environments, you want to use the lightest weight garments there are. All right, light colored garments absorbs less heat from the sun. So if you have a choice be wearing a light blue shirt and a black shirt, you want to go with a light blue shirt. So this guy is wearing a cooling vest. Cooling vests are used. They must be selected carefully and washed daily. Yeah, because it gets stinking really bad. So you don't want that. But cooling vests can come in different ways. Sometimes you put the whole vest in a ice chest and dip them down. You can put them in the freezer, or they have inserts sometimes that you put in them, and that helps to cool you. So as a supervisor, whether it's at work or at home or wherever we're doing, we got to make sure to know and to monitor the environmental conditions, what's going on around us and outdoors. You got to make sure that you make good work assignments, adjust for work practices as necessary. And what that means is job rotation, personnel rotation, and of course, PPE. We want to make sure that we observe our workers. We want to make sure they drink enough water, that they get rested, the medication, alcohol. We got to keep all of this in mind. So it's our job as managers and leaders to oversee, to make sure that our workers are adjusting to the climate and the workload that there are. So we want to definitely conduct periodic safety meetings during hot weather so everybody is aware what risk we're going to be facing. Workers' responsibilities. So the workers, they need to carry out the instructions from the training for controlling heat stress. Being alert for symptoms on themselves and others. So they need to know their limits and be able to spot what's going on with themselves and their coworkers. They need to be drinking enough water, getting adequate rest and sleep, avoiding alcohol and illegal drugs and caffeine. So as workers, we have responsibilities. We have responsibility to do the best we can on the job also.